My name is Teresa Irwin. I'm a physician at Caring Center for Women in San Marcos, Texas and New Braunfels, Texas. Patients often ask me what vitamins they should take, supplements that they should take, because there's just so much out there and it gets really confusing after a while. I'm going to speak to the most important ones that our body needs and what dosings and what things to look for when it comes to that particular subject. I call these nutraceuticals because they are basically providing nutrition through a non-dietary method. So vitamins basically are organic chemicals that are not related to each other, but our body needs in order to produce and function in metabolism. When we're deficient of them, then we have some arrays in metabolism, and this could lead to many disease processes. The human body that is, cannot synthesize vitamins. We have to actually take it in through either diet or supplementation. If we eat a well-balanced diet, then we really probably don't need a lot of the extra supplements. But the problem is that most of us do not eat the proper well-balanced diet. I'm going to briefly talk about the most important vitamins, minerals, and supplements that I recommend for proper body functioning. I'm going to start off with vitamin B9, which is also known as folic acid or folate. When our body ingests folic acid, it has to be converted to methylfolate. This is the form that needs to be used to then allow for proper DNA synthesis, which is important for the cells. It's also needed for making up the neurotransmitters and for immune function. The problem is there is actually a fair number of our population that has a gene mutation that does not allow for this process to occur. About 14% of the population carries this gene mutation, which is called MTHFR, and it stands for methylate tetrahydrofolate reductase deficiency. And if you do not have that particular gene, then you will not be able to convert folate to the proper enzyme. So how do you know if this is a problem? Well, you can get a blood test done to determine that. But if you don't know, or you haven't gotten the test, or you can't afford the test, then I would suggest to ingest the proper folic acid. Folic acid is also extremely critical in childbearing women. This is important to prevent what's called neural tube defects. What those are abnormal openings in the spinal cord and in the brain of the child. And a woman needs to be on this at least 3 months prior to becoming pregnant. Otherwise, her risk for the child developing this is very high. And this has been proven in multiple studies. So this is an area that should not be forgotten. Next topic is going to be vitamin B12. Now B12 is important because it is involved, along with folic acid, in what's called hematopoiesis. And what that is making our cells. The cells are red blood cells, white blood cells, and platelets. The red blood cells are important because they carry oxygen to all of our cells. And then the white blood cells are important for fighting infection. The platelets are used for clotting. Now, many times people come in and say, I'm tired, it must be that I'm low in vitamin B12. Well, unfortunately, that is a misconception. Most of our diets are going to be sufficient when it comes to vitamin B12. The reason that people will say they're tired and they think that they have the low vitamin B12 is because those that truly have low levels of B12 are actually anemic. And so that's why they're tired. They don't have enough oxygen carrying capacity, and therefore that's what leads to it. What are the dosages that you need? So for folic acid, it's going to be 0.4 milligrams to 1 milligram a day. And for the B12, it's going to be 2.5 micrograms daily. So in the American diet, typically B12 is going to be sufficient. However, there are certain conditions where it's going to be very difficult to get enough in your diet. That's going to be for patients who have undergone bariatric surgery or have some malabsorption disorders such as celiac disease, Crohn's disease, or if they're on a strict vegan diet. So very important that they supplement themselves with a nutraceutical.